Hello everyone, welcome to my channel. Hope you are doing well and spending some quality time for your studies. Today we will discuss a new topic that is called CBT. Might be some of you have an idea about this one, but we will just study in an in-depth way which will help us to answer the questions, especially the selector that apply questions in NCLEX Rn exam and some other exams. So what do you mean by CBT? It is called cognitive behavioral therapy. So when you will listen this word, what is coming to your mind? Usually these kind of therapies are using in mental health aspect to adaptive or to adjust with the situations when the client have some kind of depression or they have some anxiety disorders and such kind of problems. The cognitive behavioral therapy will apply and that will help the client to recover or to maintain a quality life. We'll see what are some of the aspects related to CBT. It mainly focuses on understanding the thought process the patient is going through. We said that in mental health nursing, some of the illness the client thought process is distorted or an impaired thought process. So what will happen? The things that usually a man will feel will not be the same when a mental health or a client who have some kind of mental illness. So and their thought process will be entirely different. So in such scenarios, the patient learn how to automatically understand or identify the negative thoughts or the impaired thought activities happening in their life or in their mind. At the same time, once they able to find out the negative thoughts or impaired thought process due to their illness, if the CBT or the cognitive behavioral therapy help them to identify or help them to find some good coping mechanism and to adjust with that situation. Which means if the client have some problem, maybe the client is a depressive client and always he have some negative thoughts, that thought might be making him more depressive. So in cognitive behavioral therapy, the therapist will help the client to identify that particular thought. Once he will identify that particular thought, it will help him to remove that thought or adjust using some good coping mechanisms to adjust or to recover from that situation. And the patients are given extensive homework, which means once the patient is start with the cognitive behavioral therapy, the therapist will give certain tasks and certain steps that the client should include in his daily life as homework, which will help the client to recover from his problem. So these are some of the points connected with CBT. So when you are listening a word CBT or a cognitive behavioral therapy, you should understand one thing. There is a cognitive intervention and there is a behavioral intervention. So the combination of these both interventions helping the client to recover or adjusting the problem that he had. When we said adjusting, it doesn't mean that the client will adjust with that depressive situation and he is going in a depressive stage. There are some certain mechanisms like breathing techniques or some imagery techniques that will help the client to cope in a positive way and remove that negative thoughts that is there in the mind of the client. And we will see how does it work. Usually the main indication for cognitive therapy are some of the anxiety disorders. See here you can see the cognitive behavioral therapy can be effective in treating anxiety disorders and eating disorders like anorexia nervosa and bulimia. Then depressive disorders. Then the client those who have medical conditions such as insomnia and smoking. Then these type of disorders are characterized by maladaptive reaction to stress or anxiety or any conflict. We know that certain kind of situation, it might be some of the trauma or the death of some loved ones. So the client will go to a very depressive stage. So in that time, the client could not able to positively adapt or effectively adapt to that loss. That's what we said, maladaptive reaction to stress, anxiety, or loss, or any conflict in the life. And in the cognitive therapy, we are giving some good coping mechanisms. We are providing some good adaptive techniques that help the client to properly react to the stress or properly overcome that anxiety and conflict. Is that clear? We will see. And the main thing that require the client have the skills to learn, and he also should have this therapist will help the client to make a self observation skill and apply more adaptive interventions in his day-to-day life. We'll see some of the main interventions or the components of cognitive and behavioral therapy. The first one is monitoring thoughts. We already said that it will help the client to aware of negative thoughts and educate about the client's specific disorder. For example, a client who is diagnosed with depression and he is always thinking that everything happening in his life or the things the people who is around him, everything he is looking in a negative way. There is a huge negative vibes in his mind that is making him to more depressed. He could not be happy. He could not do any pleasurable activities. So when the therapy will start, the therapist will help the client first to identify what is the negative thought in his mind, why this negative thought is coming, and once the negative thought will come, how it is affect his behavior, how it will affect his cognition. If he complete that step, the patient is able to understand the things, understand the problem or the disorder in his life. If the understanding will complete, we can say that around 20 to 25% of the cognitive behavioral therapy is successive, because now the client he know, okay, I have this problem and my way of thinking or my negative thoughts are making my life and my behavior is more aggressive. Then the next one is self-observation and monitoring. The client learns how to monitor anxiety and how to identify the triggers. Might be some, I said that the client, they have some failure in their life, and that might be the triggering factor which making more anxious, which making more negative thoughts. And assess the severity of that situation, how panic his anxiety or how severe his stress. And once this identify, next other point is that physical control strategies. In this one, there are some techniques that the therapist is going to apply. That is like deep breathing and muscle relaxation exercise. When, for example, when a client get more aggressive, he will the therapist will tell him to practice deep breathing exercise or muscle relaxation exercise. So the aggressiveness levels will come gradually, it will come low. So he will not talk in very aggressive way to some people. And if he will not talk, himself or the patient itself will feel little relief. And the another point is that journal keeping. What do you mean by journal keeping? Like it's writing down the negative thoughts or write down the stressful thoughts. So when he will write down these thoughts, he will get a relief. And that is a kind of positive adaptive mechanism. It will create a positive effect on the well-being. Another point, that cognitive restructuring, learning new ways to reframe thinking patterns, challenging negative thoughts. I already said that the negative thoughts are the main problem, or the negative vibes are the main issue that makes their life very bad. So if they have the ability to challenge that negative thoughts, if they find some other ways or patterns to reframe such kind of negative thinking, it will be good for them to be okay. It will be good for them to be adjust with the circumstances, whatever it is. Then the another one is that behavioral strategies. We already studied some of the physical control strategies. Now what are the behavioral strategies? Like focusing on situations that cause anxiety and practicing new coping behaviors, or desensitization of the anxiety provoking situations or events. Maybe some client is always talking in a very bad way, or whenever somebody will ask some things, he will start to talk in a very high pitched voice and an aggressive manner. So if he will practice some behavioral techniques, or he will use some desensitization of that aggressive provoking situation, it will help him to behave or talk in a very calm and quiet manner. Then another one is that operant conditioning. What do you mean by operant conditioning? It's like we are giving some positive rewards when the client will do something good. In the initial stage, the therapist or the CBT, the cognitive behavioral therapist will provide some techniques and some adaptive mechanisms, everything. So once the client will use those techniques and he will show some good positive thoughts in his life, that time we will give some positive rewards. We will support the client. We will reinforce, like it is called positive reinforcement. So that will help the client to recover from his negative thoughts, and he will continue to practice that positive good mechanism in his life. So these are some of the main points or the main interventions coming under cognitive and behavioral therapy. It is very important, at least you should have an idea about all these headings, like cognitive restructuring, then operant conditioning, then reframing the thinking patterns, monitoring thoughts and everything. Because in some questions it might be a select all that apply question. I already said in the first. So out of the 6 options, might be 4 options are interventions of cognitive behavioral therapy, and other 2 are some other techniques using in some other therapy, or maybe any like treatment modalities in mental health nursing. So if you don't have a clear idea about all these points, you could not able to pick all the correct options. That's why it is very important, study thoroughly and review every day. So I wish you all the best to all the students and the people who are spending time for studying the nursing classes and exams. And we'll come with some other questions related to this particular topic on the coming videos. Bye bye.